Hi again, everyone. This is Sarah Revels from New Hampshire Center for Cognitive and Behavioral Therapies here today with Jennifer Paradis.
Hi, everyone. Thank you for watching my video.
So I'm really excited to let you get to know Jen a little bit. Jen, you have some great experience and credentials already, and there's a lot of amazing things that you're doing here.
Yes.
So do you want to speak a little bit about that?
Yes. So I am licensed as a LADC, which means I provide substance use treatment for individuals struggling with substance use disorders. I've worked with that population for about 5 years, I would say, and it's definitely my passion. One of the reasons I decided to come here and work here is because there's a mission that I really believe in, and that's to provide co-occurring treatment. And that's something that I've seen time and time again is people struggling with substance use disorders have something else going on, whether that's just something on the surface, like some anxiety, mood disorder, something like that. And I love to be able to treat both because if I'm only working on one thing, it doesn't always work out. Because we have to treat the whole person, not just one part of them, and that's something I believe in.
Yeah.
Also, I love working with couples and doing relationship counseling. So I've been doing quite a bit of that, as well as some sexual health counseling, some gender counseling, sexual identity stuff.
Yeah, which is all really speaks to that sort of whole person model. A lot of looking at systems in someone's life and patterns. So right now, again, as you said, Jen, you're a licensed alcohol drug counselor,
Right.
and so you can do substance use evaluations, and you can also do the impaired driver services.
Yes.
Yeah. And if someone's court ordered to have an evaluation or treatment or needs recommendation about what kind of treatment they might need, you can do that too.
Yeah, I've done that a bunch because sometimes people don't exactly know what they need. It's hard enough for them to come to treatment sometimes, and once they get here, they're like, I'm not sure exactly what's going on. So
Yeah,
I can definitely do evaluations for court or just for your own personal knowledge, and I can say like this is where you're at right now. This is some of the recommendations I would have, and these are maybe some things to consider working together, some treatment goals.
Yeah, so if you can get yourself here, Jen can like get you straightened out. To figure out what you need, help you make a plan, right?
Yeah.
And so you have the LADC, and then I know that you are you're always learning and growing, and you're working towards your master LADC license. But as we mentioned, you can already do co-occurring work because you're in supervision here. And then you're also in supervision with me for your Jen is a candidate to be a licensed clinical mental health counselor as well. And so you can do, behavioral health or mental health treatment. And for the substance use and co-occurring stuff, people can either choose to pay out of pocket or we're getting you a network with the insurances we take here.
Yeah.
And then for the behavioral health piece, because you're pre-licensed, you're still a master level clinician for that. And so that's a middle tier $50 rate is like quite a bargain for the experience that Jen
I would say so.
Yeah.
So I have my master's degree in clinical mental health counseling, which means that I am working towards becoming licensed as an independent mental health clinician as well. So, I'm working towards both those licenses in addition to my current LADC license.
Yeah, and so much experience with substance use and then co-occurring stuff, and now we've really added in, and you've been doing great work. She's been doing great work with couples and like sex therapy, sort of enhancing that couples and individual work. So really great stuff there, so needed in the area. And then I think, when we talk about some people coming in for court order treatment, but we also talk about people coming in just because they identify a need, that reminds me of like youth. So I know you work, it's probably pretty clear by now to you all that Jen works with adults, but I know you also work with youth. Do you want to speak for just a moment about that? I think you've got like a group coming up, like.
Yep, so I typically work with ages 10 and up. And I love working with the kiddos. A lot of the stuff that I do with them is just kids that have been impacted by something serious in their life and learning some skills to kind of cope with that. And a lot of times some behavioral stuff can come up.
Right.
And I usually work in a family systems model, which means the parents are typically included because my kiddos are here once a week typically, sometimes twice a week, but the rest of the time they're not here, they're at home. So just including them parents to help them work on the goals that we have and the homework at home, and just including the whole family in it. And it's something I'm really passionate about. And I've actually started to market for 2 groups that I want to get started. I have a few people signed up yet, but I'm looking for a few more to get it really going. And I have 2 different groups. One is teens impacted by substance use, and one is children impacted by substance use. So they both are going to be Tuesday evenings every other week. So I'm hoping to get a few people to join that group so we can get it off because I already have a lot of interested folks. But it's something I think is really needed. A lot of times when a parent is struggling with substance use issue, they go and get treatment, and the family is left to cope on their own sometimes. And I think it's important for everyone that's been impacted to learn a better way and to really kind of get in line with their whole family on the same page. So that's why I opened those 2 groups. And just because of the age ranges, we split it up into 2 different groups, one for teens and one for children.
Right. And so if you have a child that's been impacted by someone's substance use disorder, or you know one, like you love one or you care about one, they can come here and they can be part of that group. And the great thing, like one of the last things I'll mention about your work, Jen, that I'm aware of is that you work from, evidence-based models, and enhance that with a few years of experience with some expressive arts, and also you use some of the animals that we have here, small animals and dogs, and so which I think is just nice when you've got the teens and the children, and you want to make a supportive place for them to be able to offer those things that they connect to.
Yeah. The animals are great. Every time I come into work, there's another animal in the lobby, and I think it's amazing because I love working with animals, and the kids especially, they love it. It can be used in session quite effectively, learning skills, using as a relaxation tool, building relationship between the therapist and the kid or the adult. It's amazing, really, what happens when we bring the animals into session, and I love it. And the art-based expressive model that I use too is really great because not everyone uses the same type of brain. Not everyone likes to sit and talk or work on my whiteboard. Some people really respond to art-based interventions because it engages the other side of your brain. So I love doing that. And also, I like to use health realization, which is a model that I incorporate with my evidence-based techniques, and it really talks about thought and how that really colors everything we see. We all have different perceptions in life, and it all just comes from our own thoughts, and it's something that people really respond well to, and I love using with my clients.
Great. So, Jen, is there anything else I didn't think to ask about or we haven't mentioned that you think is important for people to know if they're deciding, like, could Jen be my person?
I would say that I'm a kind of laid-back therapist, so I get really down to the point and get to work, but it's fun. We don't sit in like a stuffy office or anything. My office is nice and comfortable, and we joke around and we laugh, and like we're just real and genuine with each other, and that's what I really enjoy about working with people.
And I love that here. I feel like that's our culture here at NHCCBT. It's just like, you come in here, we're probably wearing yoga pants half the time. You have really great glasses, and just like we're holding the bunny, and we're like, how's it going? Want to sit on my beanbag? We're gonna CBT you, but like we're like real people. And like I don't know, I always just say like about Jen, I always say like Jen's real cool. Like, which is one of the reasons teenagers like Jen, like, just like, I don't know. Real cool, Jen.
Thanks.
So, thank you for watching this video. If you got this far with the two of us, good for you. And if you think Jen could be your person, or you think, you want to call and see who here could be your person, or if we can help you with what's going on, give us a call, 603-659-0202, or you can email us at info@nhccbt.com, and we'll see you next time. Thank you for watching.
Thank you. Bye, everyone.
Bye.